For most people, spine surgery means a big incision, a lung recovery, and a life full of limitations. This assumption stops many people from seeking out help until it's too late or the condition gets much worse. I am a spine surgeon with 100% focus on minimally invasive spine surgeries. I completed dual orthopedic and neurosurgical spine fellowship training. I have been performing ultra minimally invasive spine surgeries for many years. By the end of this video, you will understand what minimally invasive spine surgery means. How is it different from traditional surgery? And hopefully, I can give you confidence to seek out the help that you need. Let's start with the big picture. Minimally invasive spine surgery isn't about doing less care. It is about doing smarter care. Traditional spine surgery requires moving or cutting through large muscles to reach the spine. Think of it like taking down part of a wall just to fix a wire behind it. It works, but it causes a lot of disruption. Minimally invasive spine surgery is more like using a very small keyhole with a camera. We use smaller pathways, specialized instruments, and real-time imaging to reach the problem area while disturbing as little tissue as possible. The difference matters. When muscles and surrounding structures are preserved, the body doesn't need to spend as much time recovering from the surgery itself. Recovery becomes more about healing the actual spine issue, not repairing collateral damage. From a practical standpoint, this means lower infection rates, less blood loss, and a quicker rehabilitation. Many patients can get up soon after surgery and be sent home the same day or shortly afterwards. A very common misconception I hear is, if the incision is smaller, the surgery must be less effective. This is simply not true. The goal is not a small incision. The goal is precision. With modern navigation, robotics, and endoscopic techniques, we can address problems like nerve compression, disc herniations, or spinal instability with a level of accuracy that simply wasn't possible years before. These advanced techniques require additional training and experience, so I highly recommend seeking out a surgeon who is well-versed in these techniques. Patients ask me all the time, does minimally invasive mean no pain? There's no such thing as zero discomfort, but patients routinely experience less post-operative pain and a much faster recovery because there's less trauma and collateral damage during minimally invasive spine surgeries. Another question I hear is this permanent? In a way, this question addresses surgical efficacy. The durability of surgery depends on the diagnosis and not the size of the incision. Surgical treatment is highly effective and long-lasting when the right problem is treated with the right solution. This determination is not made in the operating room, but through consultation and appropriate workup of the patient in the clinic setting prior to the surgery. And then there's a question people are often afraid to ask. What happens if I do nothing? Sometimes observation, therapy, or injections are reasonable options. Other times, waiting allows nerves to get damaged or for your function to get much worse. The key is understanding why symptoms are happening, not just how much they hurt. Consulting your spine surgeon doesn't mean you will have surgery. In many cases, my goal is to discuss spine conditions with patients and go through the pros and cons of surgery versus other treatment options. Ultimately, the patient must make their own decisions. My goal is to empower you with the information you need to do so. The biggest fear patients have is thinking surgery is all or nothing decision. It isn't. Minimally invasive spine surgery allows us to treat conditions with significantly lower collateral damage. This means we can address many conditions efficiently with little to no downtime for the patient. In many cases, these advanced techniques allow us to break what would otherwise be a very long and complicated surgery into small, manageable pieces. In many cases, we can avoid a long surgery altogether by focusing on the worst problems. Minimally invasive spine surgery exists in the middle ground between doing nothing and doing too much. How much or how little we do can be customized specifically to the patient's specific problem. Remember, good spine care isn't about rushing into surgery or avoiding surgery at all costs. It is about choosing the right solution for the right reason. If you found this helpful, make sure you like the video and subscribe to the channel. I break down complex spine topics like this so you can make more informed decisions about your care.